The Centers for Disease Control is working to control an outbreak of measles centered on Kaohsiung. On March 17th, a 30-year-old man caught the virus while on a TigerAir Taiwan flight. Then, earlier this week, 2 TigerAir flight attendants were also diagnosed. Public health authorities are working to administer preventative vaccines to all those who may have come in contact with the virus.
A stream of people who are on a TigerAir flight from Macau to Kaohsiung on Monday, April 2nd, entered this hospital to get a measles vaccination. It can reduce the risk of infection if administered in the crucial 72 hours after potential contact with the virus.
I noticed the flight attendant seemed to have a cold. He didn't look well. I haven't caught it. I just had a preventative vaccine.
2 TigerAir attendants who had contracted the virus but did not yet display any symptoms passed it on to a passenger on a flight on March 17th. They then continued to serve passengers on 6 more flights over more than 2 weeks, visiting Taipei, Taoyuan and Kaohsiung. During the incubation period of the disease, they were in contact with at least 1,300 people.
Currently, we're aware of more than 200 people who the flight attendants were in contact with in Kaohsiung City, and we're carrying out procedures to track down all the people they have been in contact with. 85 passengers served on the flights are residents of Kaohsiung City. 2 people have developed measles symptoms and are currently being treated in isolation.
Measles can be spread through mucus and saliva and through coughing and sneezing. Its symptoms are similar to those of a cold, along with a telltale rash of red itchy bumps. The disease often causes serious complications and can be fatal. The Centers for Disease Control advise the public to stay mindful of their own personal health and to seek medical advice as soon as any worrying symptoms arise.